Hello, I'm Crystal Meyer, and I'm here with Dr. Maral Zarandi, a
Good
naturopath
morning.
here at Vancouver Wellness Studio. Good morning.
Good morning.
Thank you for being here with me today.
Yes, absolutely.
So, I am going to ask Dr. Maral what I've been asking our other practitioners. Through the lens of your discipline, what are the most common symptoms you've seen in working with anxiety related to the pandemic?
Yes, Crystal, that's a great question. There's been a lot of moving targets and components with what we're experiencing and kind of what we're all going through, in terms of the pandemic. We're all experiencing it together. I would say in my practice, the most common complaints I've been seeing are a lot of sleep disorders. So either, difficulty falling asleep, difficulty staying asleep, not feeling well rested. And I think the other biggest one is burnout, just, feeling exhausted and overwhelmed and not kind of in our bodies anymore, um, which makes sense because with the stress response that we've all been under, and especially chronic sustained stress that we've all been under, it's no wonder it's taking a toll on our physical selves because our bodies were wired to handle acute stressors. When it becomes something that's going on for, several weeks to several months, it becomes much more of a burden on the body, and people will start to get more symptomatic as time goes on.
That all makes a lot of sense. So what would you recommend? How are you working with some of these symptoms? What are some recommendations that you have?
Yeah. So of course, when we look at our clients and our patients as a whole, we always want to get to the root of the problem. And so in my practice, I typically don't make recommendations based on just the symptom alone. So ideally what I would recommend is finding, a functional medicine practitioner and doing some comprehensive testing. And that way you can actually know where the deficits lie. Sometimes it can be a cortisol related issue. Sometimes it can be a shift in hormones. And so there's a lot of reasons why or how chronic stress can change the body. If you know where the deficit, it's a lot easier to treat. So I definitely recommend testing for most clients, especially because it also helps direct the treatments a lot nicer. It's harder to do. I always tell people, I'm like, it's harder to throw everything at the kitchen sink and see what sticks. It's easier to figure out what the problem is and fix it, right away. The other analogy I give is, we can have two people with insomnia, right? And if we give both of the people with insomnia the same medication, it may not work, right? But if we figure out one person has insomnia because they have elevated cortisol at night, and the other person has insomnia because their blood sugar is dysregulated at night, right? Those treatments are very different. And so it's helpful to look at why the symptom is happening, not necessarily the symptom in particular. But one of the recommendations that I do give most patients is us being diurnal patterning beings, right? So we like to wake up when it's light out and we like to go to sleep when it's dark out. There is a very simple thing that everyone can implement to help with their natural sleep response, and that is to expose their eyes to bright light for at least 15 to 20 minutes in the morning. So living in the Northwest, it's obviously a lot harder. We're kind of nearing that, end of the sunshine in the morning. So if it's not sunny or you're noticing, there's not as much light in the morning, what you can do is you can get one of those happy lamps, so the Lux lights. And what they'll do is they'll emit full spectrum light, which will kind of replicate sunlight. And you just kind of turn that on in whatever room you are getting ready, and just 15, 20 minutes every single morning. That makes a huge, huge difference for a lot of people. It actually helps train the retina to communicate with the brain to create more of that diurnal patterning of the cortisol. So that's one recommendation that would help most people.
I would imagine too, Meryl, that it's true in the opposite direction. Even if you have someone where blood sugar is being dysregulated, which could be a response to stress, right? Or
Yes.
the cortisol pattern
Yes.
in response to stress, either of those
Right.
people that I think, like screen time and darkness at night
Oh, absolutely.
impacts
It's the
as
same
well.
thing. Yeah. So then the
Mhm.
opposite in the evening would be, how much exposure are you getting? And I think that's the other biggest thing through the pandemic. I think us being just more inside and having less communication with nature and having those regiments that we were more used to has created, more TV time, more phone time, more tablet time. And I think that people are now getting exposure all throughout the day, right? And so that can create a problem as well, because blue light in the evening can really disrupt your own melatonin secretion. And
Mm.
so part of this whole process is to balance out the circadian rhythm, right? And yeah, you make an excellent point. I think just in general, that's where most of the dysfunction is coming from, right? Is just this, anxiousness, and we're all on our phones and TVs, and it's creating a lot of light issues with our eyes and our brain. And so a lot of people are noticing just poor quality sleep over time.
That is so simple and so impactful. And thank you so much for helping us understand our bodies and a little bit more of how we can help ourselves in this time.
Absolutely. Thank you for having me.
Absolutely.
All right. Bye.
If there was anything in our small but potent conversation with Dr. Maral, please don't hesitate to reach out. All of our practitioners offer free 15-minute consultations, and you can find their booking information on our website. That is vancouverwellnessstudio.com. Thanks. Bye.